Welcome to Clinical Notes AI. I'm going to show you how easy it is to use our platform. First of all, you need to set your profile and select your profession. When you select your profession, it positions the AI to write from the perspective of the profession that you choose and who you are. We've trained our platform on many professions. When you're ready to do a note, click on documentation, and then you're going to choose your template type. You're going to pick a progress note. You can do intake notes. You can choose documents such as treatment plans, assessments, biopsychosocials, or we can just bring in all of your templates right out of your EHR. Let's create a note. Click on your note type. You're going to pick live, you're going to pick dictation, or a note builder. Live listens to your session and extracts relevant information to a clinical analysis to create your note. Dictation is where you give it a data dump of a history of a session that you just had. So you can talk to it in natural language and it'll write your note for you. The note builders for more complex documentation, such as combining previous notes and treatment plans to build more complex documents. Let's do a dictation. You're going to go ahead and click the start session button and start talking. I met with my client today. It was his third session. He's really been struggling with substance use disorder around alcohol, anxiety, and depression. He recently lost his job and his marriage has been on the rocks. We've worked on some communication strategies between him and his wife. We've also worked on some grounding techniques as well, rather than a coping mechanism of alcohol. We're going to review his journal entries next week. He's going to work on some communication, and I've provided him some homework. We'll review that next week, Wednesday at 3 o'clock. Provide the dictation. It's instantly going to build that transcript for you. You're going to go ahead and choose your patient. If you're EHR integrated, it'll come right in. If not, you can create one. Then you can go down, choose your note format, SOAP, burp, or DAP. I'm going to do a SOAP note here. Click generate. It takes anywhere from 5 to 10 seconds to do your note for you. You also can generate additional documentation from the session you just gave it. So if you need to do an intake, an assessment, a treatment plan, and a progress note all at once, you can do that all off of your first session. Click view. Your note is done. You can copy it. You can push it directly to your EHR. You can PDF or doc it, or you can talk directly to our AI agent to change any part of this note. Welcome to Clinical Notes AI.